Good afternoon, everyone, and welcome to our official national call for the 2026 Black Maternal Health Week campaign, which takes place annually from April 11th through 17th. My name is Asia, and joining you today on behalf of Black Mamas Matter Alliance Incorporated. We're grateful to have you with us today. This year's call is especially meaningful as 2026 celebrates 10 years of BMMA establishing the global Black maternal health movement. Over the past decade, this movement has continued to center Black mamas, birthing people, families, and communities while advancing advocacy, culture shift, and systems of change rooted in reproductive and birth justice. The purpose of today's national call is to share key information about this year's campaign, including the vision, priorities, and ways you can engage and participate throughout the week. We'll also highlight where to find resources and how to stay connected. This year's theme is rooted in justice and joy. So, throughout today's call, we'll talk through what this theme represents, share activities and moments planned so far, and offer guidance on how you can engage with Black Maternal Health Week alongside BMMA and within your own communities. So, with that, I'll now pass it over to Dakema, who will continue us through the next part of the agenda.
Thank you, Asia, for that introduction, and thank you to everyone for joining us today to learn more about Black Maternal Health Week 2026. We deeply appreciate your time, your interest, and your continued commitment to advancing maternal health equity. As the founding organization of Black Maternal Health Week, BMMA is proud to mark the 9th year of the Black Maternal Health Week campaign. Over the years, this week has grown into a powerful global moment for awareness, advocacy, organizing, and community led action centered on Black maternal health. With your continued engagement and support, we know this campaign will continue to grow in reach and impact, strengthening the movement for equity and justice across communities. During today's session, we'll walk through the Black Maternal Health Week 2026 theme, key moments and activations planned for the week, opportunities to engage, including sponsorship and merchant participation, ways to get involved as partners and community members, and a preview of activities being led across communities. We'll also share how to stay informed about local events and ongoing opportunities to engage throughout Black Maternal Health Week. BMMA is a network of Black-led and Black women-led organizations and multidisciplinary professionals whose work is deeply rooted in reproductive justice, birth justice, and the human rights framework to ensure that all Black mamas have the rights, respect, and resources to thrive before, during, and after pregnancy. Our alliance includes a diverse range of professionals from midwives, OBGYNs, nurses, doulas, birth workers, lawyers, academics, artists, and public health researchers. Our mission is to center Black mamas to advocate, drive research, build power, and shift culture for Black maternal health, rights, and justice. BMMA's focus is to build the skills, convene, and mobilize the Black perinatal, maternal, and reproductive health workforce to end maternal mortality. We do this work through the following bucket areas. We work to change policy by utilizing the human rights framework to address health inequities and improve Black maternal health outcomes. We cultivate research that leverages community knowledge and Black scholarship. We advance care by promoting holistic, respectful, and comprehensive maternal and reproductive health approaches for everyone's care. And we shift culture by dismantling negative narratives on Black motherhood and amplify the voices and experiences of Black mamas. Centering the ingenuity of Black-led maternal equity initiatives across the country and globally that are making a difference is imperative. This is the primary function of Black Maternal Health Week. Before we continue, we just want to take a moment to ground us in how we use the term Black mamas. So we use the term Black mamas to include a range of birthing people, cis women, trans folks, and gender nonconforming individuals that are of African descent across the diaspora. To those who care for and mother our families in our communities, whether they have given birth or not. We stand in solidarity with all Black mamas. With that, I'll now turn it back over to Asia to continue with an overview of Black Maternal Health Week.
Thank you, Dakema. Founded in 2018 by BMMA, Black Maternal Health Week intentionally takes place in April, which is recognized in the US as National Minority Health Month. Additionally, we begin Black Maternal Health Week on April 11th annually to join dozens of global organizations in marking this day as International Day of Maternal Health and Rights, an opportunity to advocate for the elimination of maternal mortality globally. At BMMA, we recognize maternal mortality and maternal health inequities as global issues that affect Black women and birthing people not only in the United States, but across the world. The purpose of the Black Maternal Health Week campaign is to deepen the conversation around Black maternal health, ensuring that public stakeholders understand how root causes, including systemic racism, drive persistent maternal health care inequities. At the heart of this campaign is a clear commitment to center the voices, scholarship, work, and lived experiences of Black mamas, Black birthing people, and their communities. The primary goal of Black Maternal Health Week is to amplify the policy, research, and care solutions that are already being developed and led within our communities. The campaign also works to inform policymakers and community leaders about actionable policy solutions while demonstrating to the broader public the power of organizing and the importance of sustaining space for Black leadership in this work. As we moved into the ninth year of the Black Maternal Health Week campaign, we are excited to continue building collective momentum toward equity, healing, and justice. I want to take a moment to thank our sponsors, alliance partners, and community leaders for making Black Maternal Health Week 2025 such a powerful campaign. Through Black-led organizing across our alliance, more than 60 community-led events were hosted nationwide during the week, spanning advocacy, education, and community healing spaces. Across BMMA led programming and digital engagement, the campaign reached millions of people, including over 2.5 million content views, more than 2,200 registrants to BMMA digital programming, and over 80,000 people engaged through in person events and activations across the country. Black Maternal Health Week reached an estimated 528 million people through national and local media coverage, elevating Black maternal health as a public and policy priority. These outcomes reflect the power of collective action, Black leadership, and community driven solutions. More details on the impact of Black Maternal Health Week 2025 can be found in our BMHW 25 Impact Report at blackmamasmatter.org/impact reports. With that, I'll now pass it over to BMMA's Executive Director, Angela Ina, to introduce this year's theme.
Thank you so much, Asia. This year's Black Maternal Health Week theme is rooted in justice and joy. This theme honors the fullness of this movement, the fight for structural change and accountability, and the healing, cultural traditions, and community care that has always sustained Black families. Justice and joy are not separate, they are the roots of everything that we do. This theme signals something intentional. It is a celebration of movement building, of the strength and resilience of Black led perinatal, maternal, and reproductive health organizations that have carried this work forward year after year. At the same time, it acknowledges the enduring systemic oppression and reproductive injustices that our communities continue to face. We hold both of those truths together. Joy is not a luxury, it is a birthright and a practice of liberation. The events and programming planned for Black Maternal Health Week 2026 will fully embody this theme and offer meaningful opportunities to engage in activities and conversations that honor the values and traditions of the birth and reproductive justice movements. Now, 2026 is a milestone year for BMMA. We are celebrating more than 10 years of establishing the global Black maternal health movement. This work, this divine work, began through a partnership between the Center for Reproductive Rights and Sister Song Women of Color Reproductive Justice Collective, who together released an investigative report called Reproductive Injustice, a report that documented the childbirth and healthcare experiences of Black and Hispanic women in the South and exposed human rights atrocities happening in our own healthcare system. This was unfolding against the backdrop of the Black Lives Matter movement, and it compelled both organizations to bring together advocates, providers, and stakeholders to Atlanta, Georgia in 2015 for a convening on addressing maternal mortality in the United States, aptly called the Black Mamas Matter Project. A toolkit was developed, and after a second convening in 2016, five of us stepped forward with the support of both CRR and Sister Song. And so in November 2016, at the beautiful Mother House in the western area of the Atlanta, Georgia, we birthed the Black Mamas Matter Alliance. Those founders are Elizabeth Dawes, Dr. Joya Crear Perry, Kwajalein Jackson, Monica Simpson, and myself, Angela Doinsala Aina, along with the advisory support of Katrina Anderson, Pilar Herrero, and later Brianna Lipscomb. What started as a project became a movement, and that movement is now global. So I invite everyone to join BMMA throughout 2026 in all of our programmatic activations by signing up for our newsletter at blackmamasmatter.org/connect. I want to take a moment to speak directly to the public health and perinatal workforce. Our midwives, doulas, lactation consultants, nurses, physicians, home visitors, first responders, community health workers, and every person showing up to do this work with integrity, principled values, and a commitment to science and evidence based care grounded in human rights. My loves, we see you, and what you are doing matters now more than ever. We are in a challenging social, political, economic, and deeply violent time period. We mourn Dr. Janelle Green Smith, a Black certified nurse midwife in South Carolina who dedicated her career to making childbirth safer and who lost her life to complications of childbirth on New Year's Day. We hold the story of Adriana Smith, a nurse in Atlanta who was declared brain dead during pregnancy and whose body was kept on life support for months without her family's consent until her baby was delivered by cesarean. We are watching pregnant people be detained, shackled, denied basic care in ICE custody, and our communities are facing inhumane raids, detentions, and the criminalization of the most vulnerable among us. None of this is okay. And in the face of widespread misinformation and disinformation, my God, we need you all to keep going and to keep pushing back. Keep centering science. Continue to protect, educate, and love our children. Keep centering and doing the work of human rights. Keep centering the communities that you serve because it is imperative now more than ever that we continue to build community, organize, collaborate, and strengthen our partnerships. That is what Black Maternal Health Week calls us to do, especially this year. This is what this movement requires of all of us. So, therefore, rooted in justice and joy means we do this work together. This movement grows when we show up, build relationships, and strengthen what already exists. So, here's how everyone, nationally and globally, can get engaged this year. Support local organizations. Identify birth and reproductive justice organizations in your area. Find out who is participating in Black Maternal Health Week and show up to those events, panels, walks, and trainings. Build relationships. Connect intentionally with Black led and Black women led perinatal, maternal, and reproductive health organizations. Strengthen those partnerships beyond 1 week. Volunteer and invest. Give your time, give of your resources, fund the work. Sustained support is what keeps this movement strong, and amplify the message. Use your voice and your platform. Share campaign messages, events, and advocacy actions. Use the hashtag BMHW26 and hashtag rooted in justice and joy. Engage with and share the materials from the toolkit and stay connected. Follow BMMA and our alliance partners. Sign up for our newsletter again at blackmamasmatter.org/connect. And please stay engaged and actively involved beyond this week. Now I'll turn it back over to Dekema.
Thank you, Angela. As we prepare for Black Maternal Health Week 2026, rooted in justice and joy, we're excited to activate powerful digital campaigns and community-led events nationwide. We officially kick off Black Maternal Health Week 2026 on Friday, April 11th, which marks the International Day for Maternal Health and Rights, as well as Black Doula Day, honoring the leadership of Black doulas and birth workers. Throughout the week, expect digital activations, policy engagement, educational programming, healing spaces, and community gatherings led by BMMA and our Black-led partners across the country. For our Atlanta community, we're looking forward to the annual Black Maternal Health Walk and Community Fair happening Saturday, April 11th. Registration for that will be coming soon. Be on the lookout so you can secure your spot if you're here in Atlanta. The Black Maternal Health Week 2026 Toolkit launches today with resources to help you amplify key messages and actions. We encourage everyone to get involved. This movement grows when we show up and take action together. Visit blkmaternalhealthweek.com, follow the hashtag BMHW26, and stay connected throughout the week. We're also grateful to our sponsors and partners, past and present. If your organization is interested in becoming an official sponsor of Black Maternal Health Week 2026, we welcome your partnership. We're excited to offer multiple sponsorship tiers in support of Black Maternal Health Week 2026. Whether you join us as an upholder, supporter, advocate, or change maker, your partnership helps sustain and amplify Black-led leadership, organizing, and care work addressing maternal health care inequities. To learn more and become a sponsor or merchant, please complete the BMHW 26 sponsorship and merchant form today at bit.ly/BMMA sponsor. We also offer volunteer opportunities throughout the campaign. So if you're also interested in becoming a part of this work through volunteering, visit bit.ly/BMMAVOL. To stay informed, be sure to sign up for our e-newsletter and stay connected as well. Passing it back to you, Angela.
Thank you. Our alliance partners and Black-led community-based birth and reproductive justice organizations are central to the impact of Black Maternal Health Week. Their leadership, organizing, and community-rooted work help ensure that this campaign reaches communities nationwide and reflects the lived experiences of Black mamas and birthing people. As the week approaches, we encourage you to visit the Black Maternal Health Week website to explore the BMHW26 local events page, where official events and activations will be listed as they are announced. We also encourage you to stay connected by signing up once again for our newsletter and following BMMA and all of our partners across the Alliance, across multiple platforms on social media to keep up with the latest updates and opportunities to engage in all of our work. Now, we're excited to give you a sneak peek into some of the dynamic activities and programs our partners are planning in their communities for Black Maternal Health Week 2026. To kick us off, we're going to Pennsylvania to hear from Salima McNeil of Oshun Family Center. Salima.
Yes, ma'am. Thank you so much. I need like an extra 15 seconds because there is no way we are going to skip over BMMA's all Executive Director Angela Ina on Time 100 Health honoree for 2026. Please, everybody, just light this comment section up. We're giving Angela her flowers for making Time Magazine for issues that impact Black maternal health. So please, please, please give it up for Angela. And we would not be here if not for her leadership. So thank you so much. Super excited for you. My name is Salima McNeil. I'm the founder and executive director of Oshun Family Center here in Philadelphia. And what you see pictured on the screen was brunch last year. So if you were on a call during Black Maternal Health Week, this is what we were doing when we got off. We absolutely had a Cirque in Noir, a birth worker brunch where we come together every year to celebrate, not just do hard work, but celebrate being in this Black maternal health movement. And this year is no different. It is better, it is smaller, it is more intentional, and it is right what we need based on what the community has asked us to do. So, next slide, please. Join us here in Philadelphia for a whole lineup for the entire week. We started this year with making very intentional partnerships to help all of our events move forward. For instance, we are partnered with Baby Be Soothed. Ms. Brooke Smith is in the comments section as well for our Joy and Justice Baby Boutique, which is a unique shopping experience. We typically host hundreds of people for our community baby shower, and now we are going to wrap all of these families around with services and supplies. We rest on Sunday. On Monday, we do have an Empowering Care and Elevating Voices, our maternal health summit, which is in collaboration with Access Matters. We're also on that Tuesday going to Harrisburg with the PA Black Maternal Health Caucus before we get back for an evening of truth telling with Dr. Dorothy Roberts that'll also be moderated by Carla Mendez, who's the executive assistant here at Oshun Family Center and the lead for our Rebel Reader Society book club that will span the entire year. We're going to rest on Wednesday, and then on Thursday, we'll be at City Hall for our Day of Justice, where they introduce a resolution for Black Maternal Health Week. And then throughout the entire week with our partner over at the Positive Birth Corner with our host, Mary Nisi, we will be releasing our podcast episodes that we sponsored for her for the entire week. And we have midwives and doulas and infertility warriors and psychotherapists who all serve as hosts for that time. And then y'all know, like no other, we will be ending this week with celebrating 10 years in this Black maternal health movement in this space. I've been on Angela Hills for years. I've been following BMMA around this country since then because as a collective, we have been able to tackle these issues. So if you are in the tri-state area, please get your ticket because they don't last long and join us for a Bridgerton theme brunch. Come in your gear, come with your smiles, and come with your celebratory efforts to join us as we not only uplift Black maternal health, but we celebrate 10 years in this Black maternal health movement as we have seen some of the fruits of our labor because we are not where we were 10 years ago. So again, please give it up for Angela and the whole BMMA team that ushers us through this every single year and being Time 100 magazine for health as an usherer through this. So thank you so much. Sign up. We got links in the chat box. And I look forward to seeing y'all Black Maternal Health Week. Back to y'all at BMMA.
Salima, my love to you, to the team at Oshun, and for all the wonderful work you all are doing, especially in Philadelphia. Thank you, thank you, thank you, thank you. Thank you so much for sharing your Black Maternal Health Week 26 plans with us. Next, we're going to California Love to hear from Skylin Hayes of Black Women for Wellness, who will give us a glimpse into what they have planned for Black Maternal Health Week 2026. Skylin.
Good afternoon, everyone. Thanks so much for having me. I'm so excited to share what we'll be doing for Black Maternal Health Week 2026. I am ready to show you how we all plan to uplift and celebrate during the week. Next slide, please. So first, we have our activation event, which is our Dear Mama event, which is a letter writing gathering specifically centered around Black motherhood and all stages of motherhood, whether it be During pregnancy, postpartum, or any journey you're experiencing during motherhood. That will be on April 13th, Los Angeles, California, 6 p.m. to 8 p.m. Next, we have our Black Mamas Birthing Tour, which is a full day immersive tour of hospitals, birthing centers, and imaging providers and wellness spaces to explore maternity, birth, and postpartum care options. This will be taking place on April 15th, 2026, from 9 a.m. to 5 p.m. Our next event is Rooted in the Womb, which is a womb activation, healing, and movement based experience for Black mothers at all stages. That will be taking place on April 16th from 4 p.m. to 6 p.m. And last but certainly not least, we have the fourth annual San Joaquin County Black Maternal Health Symposium, which aims to raise awareness, share knowledge, and foster collaboration to address disparities in maternal health care. This will take place on April 16th in Stockton, California from 10 a.m. to 4 p.m. If you all are interested in these events, you can scan the QR code to the left of your screen to stay up to date, stay connected with all we're doing within Black Women for Wellness throughout the year as well. And we'd love to see you there if you can make it. Thank you.
Thank you so much for the work that you all are leading in your community. We really do deeply appreciate it. Up next, we're going to South Carolina, but taking it to the airwaves to hear from Crystal Irby with Dem Black Mamas podcast to tell us more about their BMHW 26 activations. Crystal.
Hi, everyone. I'm Crystal Tennille Irby. I'm one of the co-hosts of Dim Black Mamas podcast. My other co-host is Nikisha Killings, and all of our events are rooted in our collective power to highlight the work of Black birth workers who are going beyond helping Black mothers survive birth, but explore how we can create spaciousness for Black mamas to explore how motherhood expands their identity and allows the myth of motherhood to crumble at their feet. And we want to dig motherhood from under the grave of self-sacrifice and think about sacred sacrifice. And we want mamas to dream and dream big. Our mantra is motherhood is not the graveyard of dreams. And we're all about healing, creativity, and liberation. Next slide. So our events include the following. Our episode for the week will be with Tiffany Bishop and Whitney Coble of Raising Resilience. They are both perinatal mental health certified therapists, and they run a full-fledged maternal mental health practice and provide virtual counseling and support to mothers across North Carolina and DC, and offering a safe space of healing and empowerment. And we want to examine particularly how Black birthing persons navigate their particular challenges when it comes to postpartum and returning to work. And again, how we can create that spaciousness so that motherhood can be an experience of exploration and curiosity and leaning into this new person and expanding your identity. We also have a playlist for Black Maternal Health Week, so you can send us any song suggestions for the week, and we can add that to our playlist. And you can also send us questions for our guests. We have a QR code, so you can use the QR code to do that. And finally, one of the things that we're really, really excited about that we just started this year is called We Are the Ones. And we talk about the good news in Black maternal health, because we know the numbers. But all of us, some of us survived, and we don't just want to talk about surviving. We want to talk about thriving. So we want to celebrate the good news in Black maternal health. So if you are a birth worker, if you are a mama and you gave birth, you had a joyous birth, you had a beautiful birth experience, we want to hear about that, and we want to share that. And that will be live on Wednesday at 7 p.m. on YouTube. And we just talk about some of the good news that are going on, birth centers that are open, and different things that people are doing in their communities to help turn the tide of Black maternal health. And if you use the QR code, that's how you can follow us to see everything that we have going on, to listen to our episodes. And I'll also put our website in the chat.
Thank you so much, Crystal. We appreciate you for taking the time to share your work and upcoming plans. Now, we'll turn it over to Isha Johnson of Black Mothers Breastfeeding Association, located in Michigan, to share what they have in store for Black Maternal Health Week. Isha?
Hello, everyone. Good afternoon or good morning, depending on where you are. Thank you all for allowing me to be here. My name is Aisha Johnson. I'm the program director at Black Mothers Breastfeeding Association, a community based nonprofit rooted in Detroit. Our mission is to reduce racial inequities and breastfeeding support for Black families and to ensure that parents have access to trusted, culturally grounded care during pregnancy, birth, and postpartum. As we gather during Black Maternal Health Week, we honor this year's theme, Rooted in Justice and Joy. And the theme reflects exactly why our work exists. Justice speaks to systems changes as we are advancing through the Triple Crown Initiative and the joy that reflects outcomes that we want for all of our families. And this initiative is in partnership with Henry Ford Health and funded by the Office of Minority Health, and we are also in partnership with 10 additional community stakeholders here in Detroit, focusing on strengthening coordination between clinical teams, community based services, while expanding the workforce that supports families. And today, I just want to share a few key accomplishments that really demonstrate how we are continuing to put this year's theme into action. As you see on the screen, there are a couple of national recognition and visibility. So this past year, our work has really received a significant increase in recognition on national and state platforms. So in March, we presented at the AmChip conference, our session partnering to expand community-based breastfeeding support for Black mothers, highlighted how our training our trained peer counselors have expertise in being really integrated in community care settings through the Triple Crown Initiative. We also have a peer review manuscript that was released this month, which is really exciting. It is in the Journal of Healthcare for the Poor and Underserved, and it's titled Reverse Integration, Community-Based Breastfeeding Experts Integrated with Integrity into Traditional Clinical Prenatal Care. The article documents how, once again, our BEMFA-trained breastfeeding peer counselors are now a part of clinical care teams, which is really major. And finally, we were featured in a statewide announcement from the Michigan Department of Health and Human Services, acknowledging our contribution to Michigan's historic reduction in infant mortality. This recognition underscores the importance of community-driven services across the perinatal period. And together, these accomplishments reflect how our Detroit based community work is transforming statewide strategies and being recognized on national stages. You can go to the next slide. So, along with the national visibility, one of our most important accomplishments has been advancing system level integration of breastfeeding peer support. So, through this initiative, our two breastfeeding peer counselors, Kelsey and Monica, are now fully integrated into Henry Ford Health prenatal clinics. And as I mentioned, this is a major shift in how families are receiving support in Detroit because they are now embedded directly into clinical spaces and working side by side with nurse navigators, providers, and care teams. And this integration really did take a lot of thoughtful planning. We had to align workflows and coordinate referrals and create, shared communication processes. But as a result, families are now receiving seamless breastfeeding support before birth, in the clinic, and throughout their postpartum care. And this reduces service gaps and builds continuity across clinical and community settings. So, as I close, I just want to say thank you to Henry Ford and the Office of Minority Health. We are very proud of the progress we've made through the Triple Crown Initiative and the impact we're seeing for our families. And for Black Maternal Health Week, we will continue to collaborate and push forward for the better outcomes of our families in Detroit. Thank you.
Thank you, Aisha. Thank you so much. We really do appreciate all the work that BIMFA continues to do. Very grateful for your leadership and partnership. Next, we're excited to hear from Nicole Wardlow with the National Black Midwives Alliance, who will share their plans for Black Maternal Health Week 2026.
So I'm just going to say thank you. I'm so grateful to be here. The National Black Midwives Alliance is the first and only professional organization that was created for Black midwives with a 501c status. And so, with that being said, Black maternal health is us every day, not just for a week, but every single day. And we will be kicking off our Maternal Health Week celebration when we host our conference, which will be next month at the Landing in Hampton, where all of the midwives and our midwifery enthusiasts will show up with us. At that time, we will also be working and collaborating with other birth workers and in terms of what they're doing during Black Maternal Health Week. Specifically for us, we will be hosting a webinar during that time, and we will also be uplifting all of the midwives and birth workers that across the nation. So we look forward to seeing you then.
Awesome, awesome. Thank you so, so much, Nicole. And also, thank you in a big, big virtual hug to each and every one of you and all of our alliance partners for giving us a preview of what's to come for Black Maternal Health Week 2026 in communities across the country. We hope you're feeling inspired and excited about the week ahead. Again, happening April 11th through 17th. And so, this is what Rooted in Justice and Joy looks like in action. So, Asia, I'll pass it back to you to share more about how everyone can get involved.
Thank you, Angela. So, we're excited to share that the Black Maternal Health Week 2026 Toolkit launches today, immediately following this call. This year's toolkit is packed with ready to use messaging, key statistics, graphics, digital assets, and advocacy actions designed to help you show up, speak out, and stay rooted in justice and joy throughout the week. You'll be able to download it at blkmaternalhealthweek.com. So be sure to grab it, share it, and start mobilizing your communities right away. As a reminder, BMMA's logos, including the BMHW26 logo, are proprietary. Unauthorized usage of the logos are prohibited. The names, trademarks, service marks, and logos of BMMA may not be used in any advertising or publicity or otherwise to indicate BMMA sponsorship of or affiliation with any product or service without BMMA's prior express written permission. You can, however, use the official hashtags for Black Maternal Health Week, which is further described in the BMHW26 toolkit. You can forward all general BMHW26 inquiries to bmhw at bmmainc.org and media and press inquiries to press at humanimpactsolutions.com. As a courtesy, we ask that you allow 48 to 72 hours for a response as our team is working diligently to create an engaging campaign. So we want to thank you again for joining us today for Black Maternal Health Week 2026 National Call. Please stay connected by signing up for our e-newsletter and following us on all social media platforms. Thank you and have a great rest of your day.